welcome you to the BEAM Practice Improvement Network. Today is our kickoff webinar, and we're certainly looking forward to working with everybody. The agenda for today, we've got a lot to cover, so we're going to move through some of the early stuff relatively quickly. Talk a little bit about introductions, who we are, what CTAC is. You're going to meet some of your fellow BEAM clinics as part of this initiative. We're going to give you an overview, talk a little bit about the self-learning system that you'll be using, give you some demonstrations of how to use that system, and we'll take a quick look at the financial benchmarking tool that you'll be filling out through the course of this initiative, and then we'll finish up with next steps. So, CTAC. What is CTAC? CTAC is a training, consultation, and educational resource center that's available to all behavioral health providers in New York State. The goal is pretty simple. The goal of CTAC is to provide technical assistance, training activities, and tools that promote effective care through efficient practices. CTAC has had a number of initiatives over the last 3 years, and this is our current CTAC offering. CTAC is funded primarily, as you can see across the top of this screen, we have New York State, the Department of Health, Mental Health, Substance Abuse, OCFS, New York City Health, New York State Health Foundation, and some of the partners you'll see below: GCASA, CCSI. You can take a look at the others. This is the primary group that funds and supports our CTAC initiatives. One thing I do want to point out on this slide is the website on the bottom, www.ctacsny.com. If you haven't been to the CTAC website yet, I would recommend that you jump on that website. There's a wealth of information, tools. You'll see a number of the different initiatives that we've provided, both the clinical initiatives for adult and children, our business efficiency practices. Pretty much everything that we've done to date will be on that website. As you go through that website, this particular business efficiencies initiative with us right now, there may be additional information that you may find to be particularly pertinent and helpful for you. So this particular, I'm going to take a second on this slide because this is some important information that you need to really know about this initiative. It is funded by the New York State Office of Mental Health, but it's a distinct relationship from the Office of Mental Health in that we are a group that, although is funded by them, you'll see that from time to time, we're called upon to share participation data with OMH, that is, who the clinics that are participating in some of our initiatives. We will only share de-identified data regarding clinic financial stress to OMH, and we have done that in our initiatives in the past, and it's been helpful for OMH as it takes a look at some of their policy decisions. But we do not identify individual clinics, and we will certainly not share any clinical, financial, or other data that you generate as part of this process. OMH has agreed to this, so anything that we talk with them about, any information that we provide to them is de-identified. So you can feel comfortable and confident that the information that you're generating will be your information, and you will be able to share with your other BEAM members as we go along, but that will be at your discretion. And CTAC on occasion is asked to share views regarding clinic experience in general, but we do not engage in advocacy. Some of our partners do in some of their other roles, but CTAC in itself is not, does not advocate as we are a technical assistance center. So, preparing for change in behavioral health, I don't need to tell you about changes that are going on in the behavioral health care, in the healthcare system. I'll just throw out a couple things in DSRIP and health homes, value-based reimbursement models, certified community behavioral health centers, and then of course there was the ICD-10 conversion, shift to Medicaid managed care that's going on. It is a dynamic environment that seems to be changing daily. I've been as Chief Financial Officer for Spectrum Human Services. I've been sitting in this chair for 32 years now. I've seen a lot of changes come and go, but nothing that like what we're seeing today in terms of the speed of changes and the scope of the changes. It's putting tremendous challenge on our individual agencies, on yourself, and on the system as a whole. And some of the problems is that we have is that it's so dynamic. There's not a lot of success to point to. We get information, you know, sometimes it feels like the state's making things up as they go along. And it's difficult to plan, and it's difficult to understand what our future needs to look like. But it is pretty critical that we get started and certainly begin putting the changes in place that we're going to need. And we're going to figure out what we're going to keep on doing, what we're going to have to stop doing. We're going to have to take a look at our organizations and how they're designed and our service delivery systems. And, you know, we're all in this together. There's not, you know, there's not a lot of successful providers in New York State because we're all involved in this dynamic change as we go along. But we do know that there'll be some things that we're going to have to talk about: productivity, operational efficiencies, redesigning services, performance measurement systems, staff development, effective and outcome-oriented practices. That's certainly outside of the scope of what we're going to be doing in this initiative as we're going to be, but starting point, I think, is pretty critical, particularly for the clinics, is to get our business practice as efficient and effective as we possibly can, and that's what we'll be focusing on. Here's some of the BEAM resource team. I've been working with CTAC and many of these BEAM members for resource team members for going on 3 years now. I think that one of the real advantages that we have as part of this team is many of us are doing the same thing that you're doing right now. We're still in executive leadership, clinical leadership, operational leadership roles within our organization, and we're struggling with the same things and the same challenges that you are now. So we bring a real operational and real life set of views to this process. Some of our other participating CTAC team members. So what we're going to do is we're going to jump to 3 polling questions. One of the things that we always like to do is better understand who's out there and what some of their concerns are. So what we're going to do is we're going to stand up the first polling question. We're going to give you about 20 seconds to answer it, and then we'll take a look at the result. The first polling question, as you can see, is what are some of your primary concerns? Fiscal and quality, staff productivity, access, payer mix, collecting fees, other, or not sure. So do you want to put that those polling questions up for us, please? Go ahead and take a couple seconds, and please give us your answers. Okay, we're going to move through this pretty quickly, so let's take that polling question down. And it'll take about 20 seconds, and we'll take a quick look at what people's primary concerns are right now. This is always the dead air part of this conversation. Here we go. So we're looking at the results here. About 24% are concerned about balancing fiscal and quality, 10% staff productivity. Nobody's worried about access, which is good, a little interest in payer mix, and then the next highest being collecting fees for service delivery. Great. So let's move along to the second polling question. Let's stand this question up right away, and I'll talk through it. Please, Todd, let us know what best describes the roles of the individuals participating with you today in today's webinar. You'll see this question come up as we move forward. Also, this is an important piece to us to know who is in fact teams working together. So please take a second and let us know who's in the room. Well, I talked enough to have that going for 30 seconds, so let's stand this down and see what our answers are. All right, let's take a quick look at the results. 20% of the folks who are involved are executive leadership, 13% are clinical leadership, 16% are financial, 9% are billing, and 6% is other professional staff. So thank you. We've got a good mix, which is really exactly what we're looking for. So let's jump to our final polling question. Stand that up right away. Has your agency implemented any of the following? These are some of the business efficiency offerings that we've had in the past: open access, centralized scheduling, collaborative concurrent documentation, engagement sessions, none of the above, or I'm not sure what these terms mean. So if you do a quick answer for us on that. All right, let's stand that down and then take a quick look at what folks have implemented. Okay, take a quick look at our results here. 14% have implemented open access, 13% centralized scheduling, 9% collaborative and concurrent documentation, 5% engagement sessions, 9% none of the above, and 13% of the folks were not sure what these were. That's good, as we'll see that many of the clinics are implementing some of the business efficiencies that we've worked on before. So now I'm going to pass my presentation over to Jason Kubiak, who's going to talk a little bit about who the other BEAM clinics are.
Thank you, Dave. We have 44 unique mental health clinic providers participating in the BEAM initiative, and we wanted to share with you some of the quick details related to the participants. The information is based on the data that was collected with the online application through the Learning Management System, or the LMS system. So we first wanted to share with you just a geographical representation of where the clinics that are participating are. So what we have here is just a basic map of New York State. and the distribution based on zip code of the 44 clinics that are participating in the BEAM initiative. So you can see the dots represent the locations across the state of the various clinics that are participating, and the colors are associated with the affiliation or the types of clinics that are participating. So right now we have all selected, and you can see the various colors associated with those clinics. And if we click on, for example, freestanding, you can see the color associated with a freestanding clinic that's participating. In this case, happens to be green. A comprehensive health system was orange. Government was red. The hospital-based then being purple. Folks, an appreciation that we have a pretty decent distribution of clinics participating across the state, a mix of upstate and downstate providers that are in the BEAM initiative. Here, also wanted to share with you that the size of the circles is associated with the client-served information that was collected through the LMS system. So you can see the larger the circle, the larger or the higher number of individuals that clinic reported that they serve on an annual basis. So we have a variety of sized clinics as well. I'm going to take you over to one other tab here just to give you pretty much the same information, just broken up a little bit differently. So here we have the affiliation of the providers by size, as well as the size of the providers based on affiliation. So from the top graph, you can kind of get a sense of that the largest type of clinic that are participating are freestanding. Again, that's the green color here. And the largest overall is there are freestanding and the 1,000 individuals or less sized clinics. So although we do have a good mix of larger sized clinics as well. Okay. Going to bring us back over to the PowerPoint here for a second. And really the next page in our slide, again, just gives you a distribution of the raw data associated with the clinics participating. So I mentioned that there were 44 unique clinics that were participating. You can see our N here is 45. There were a few clinics that selected more than one affiliation, for example, a hospital-based and also a comprehensive healthcare system, and there was one response that was missing the affiliation. So that brings us back down to the 44 clinics participating in the BEAM initiative. At this point, I'd like to turn the presentation over to Donna Perry to talk a little bit more about the BEAM overview.
Thank you, Jason. My name is Donna Perry. I'm a member of the BEAM resource team, and I'm going to walk you through what you can expect by participating in the BEAM initiative. So first, I just wanted to share with you that as we go through our various CTAC initiatives, we do, garner from our lessons learned and incorporate those into our newer initiatives. So in this case, we wanted to share with you that some very key lessons that we learned that are critical to the success of any of our initiatives, whether they're BEAM, CARE, or otherwise, is strong collaboration between executive, fiscal, program, as well as operation management. That is very clear, and you're going to hear that theme throughout our presentation today. Also, a significant time investment. Everybody already has a full-time job, but it's really important that you not underestimate the amount of time it's going to take to participate in BEAM and be successful. Having strong, dedicated financial expertise, having staff buy-in at all levels, and then a very thorough understanding of your clinic financial model through the CTAC-approved financial benchmarking tool, and that will be accomplished if you participate through the BEAM initiative. So what can you expect in the year ahead? BEAM, again, today is our launch, is a self-assessment process where you start out by completing the benchmark tool. Then once that tool is complete, we will walk you through a self-assessment process and helping you to identify changes that are going to give you the greatest value. And then CARE is targeted to launch in April of 2016. This is where we take a modularized approach to improving your selected business processes. We anticipate our areas of focus to be on productivity and revenue maximization, but certainly the areas of focus will depend upon clinics' interests. vision. In order to successfully complete a self-assessment, planning, and implementation change process, forgive me, I went ahead a slide. So in order to improve access to high-quality, effective, and sustainable mental health clinic services serving the most vulnerable, clinics need to be able to build a network of providers that will support, engage, and collaborate with each other in order to meet the challenges of our rapidly changing environment. What we hope to achieve through this mission is to build capacity for the delivery of services through a self-assessment, planning, and evaluation process to support clinics in achieving ongoing changes and providing opportunities for clinics to interact, exchange information, as well as disseminate information on best practice implementation models. Our primary goals in order to successfully complete this self-assessment and change process, again, it's important that you have the available capacity, that you have the system infrastructure for ongoing data collection and analysis, the ability to initiate significant organizational change, both structurally and culturally, recognizing the interconnectedness between effective clinic and financial operations. In order to meet those goals, we actually have three supplemental goals. One being organizational self-awareness. All leadership need to be knowledgeable about the organization's financial structure, understand the fiscal components understand the intricacies of fiscal components impacting organizational processes, and then the ability to make data-driven decisions within their daily clinic operations. All staff need to be aware of and understand their role within maintaining or improving the organization's fiscal status, and then leadership need to be able to synthesize their understanding of the organization's financial structure, identify barriers to change, set realistic short-term benchmarks in order to support continued progress towards achieving a clearly articulated long-term goal. So goal one, organizational self-awareness. Two is organizational capacity. Agency leadership and staff demonstrating a need of commitment to the in-depth planning and change process, leadership actively working to address both internal and external organizational barriers to change, and then the agency putting in place structures that allow for continual monitoring of ongoing status through the routine collection and analysis of both fiscal and outcomes data, and then of course supporting staff through these process changes. And then lastly is collaboration, provider collaboration. Agency leadership will form informal and ongoing relationships with other provider agencies going through similar changes, and leadership will participate in collaborative discussions and initiatives around robust brainstorming. So again, I shared with you what BEAM's primary goal is. I shared with you three supplemental goals that are important for organizations to buy into BEAM. Again, organizational self-awareness, organizational capacity, and then provider collaboration. Our BEAM principles are a structured approach to changing clinic operations and finance, database decision-making, building strong relationships within fiscal and clinical staff, sequential learning through a self-guided time investment. This is what we hope you, your core implementation team, or CIT, as you're going to hear us refer to them, here's what we hope you will get out of BEAM, that the fiscal staff will know how important the financial data is and how it relates to operations, and that the fiscal folks can actually speak a language that the clinical folks can understand to more clearly identify and model how different operational changes will affect financial viability. For our clinical staff, that they'll learn how to embrace numbers and maybe even love them. Again, that language barrier, that they'll be able to speak effectively so that the clinical and fiscal folks can work together on building this model, and that the clinical staff appreciate that the changes affect the viability of their clinic. And of course, that all staff will learn how to approach these changes together as a team. So where are we today? As of now, you should have completed our online application and returned the cover sheet. Through the result of completing the online application, you should have identified your core implementation team or your CIT team. It's extremely important that your CIT include agency executives, clinical leadership, clinical staff, and financial leadership. And then, of course, that you participate in the kickoff webinar, which is today, being recorded. And for those who weren't able to participate today, you'll be able to get the webinar in the learning management system. So our basic structure is to take advantage of the CTAC Self-Learning Center, and you'll hear more about that in a moment. But each module represents a step towards an in-depth understanding of your clinic business model, identifying opportunities for change that will have the greatest fiscal impact, and developing a change plan for moving forward. So we'll show you a visual of those learning modules in a moment. We're also going to be having office hours on alternating Mondays. So simply you would go through each module. In between each module, you would participate in the office hours, and then we would have technical experts available to answer any questions that you might have so that you can proceed to the next module and continue to build your business model. We also will have supplemental trainings that are offered on specific topics. We have a few that are already recorded and available in the CTAC Self-Learning Center, and others based upon feedback from you will be created and also made available. And of course, all of this is moving you towards completing and submitting your benchmark tool. So the flow diagram that you see up above, each one of those blue boxes represents a learning module. The modules themselves are roughly 45 minutes in length, so we're highly recommending that you get your CI team together to review these modules together. If you set aside 1 hour, that should be more than enough time to not only listen to the module, but to have a few minutes to debrief, talk about homework and next steps, and then of course if you have questions, to submit them to the CTAC email account, which you'll hear about in a moment. And then again, back to our office hours, so alternating between those learning modules, the resource team will be available to answer your questions. We want your questions in advance to the email beam@ctsi.org. Again, office hours are alternating Mondays, Tuesday if a holiday, between 12 and 1. And then wrapping up today's webinar, we'll send everybody an email which will give you the links to register for the office hours. And lastly, the office hours, they're open to everyone, but they're not required. They are recommended, though. And I referenced before the supplemental webinars, so we've got some webinars up on tips and tricks for running effective meetings, some basics around Excel, and then managing your workload. And again, as we hear from you, we'll continue to develop additional webinars and post them on the learning management system for your reference. So at this point, I'd like to turn it over to my BEAM colleague, who will be walking you through the learning management system.
Great, thank you, Donna. So hi everyone, my name is Jason Jones. I am helping to coordinate this project over at CTAC, and I'd really like to take the opportunity to introduce you to CTAC's Self-Learning Center. So the Self-Learning Center is the first opportunity that we've had to provide self-learning to all of our participants. So throughout the year, we'll be building it out with various courses, opportunities for you to really take advantage of the resources that we have. And it's all self-learning through our new learning management system. So I'm going to take you through that and talk a little bit more about BEAM. So first, to access the Self-Learning Center, simply go to www.lms.ctacny.com. Many of you already had to do this to access some of the BEAM materials, mainly the provider application. But for any of you that haven't, you could simply click on New User, sign up here, and create your user profile. So we're asking basic information, what organization, what program you're part of, your email address, and your name for you to get a profile. You would click on Catalog to view the current offerings, and then you would enroll in your desired course. From there, you'd click on My Training to access any modules. So to enroll in BEAM, you'd actually follow that same process. You'd go to Catalog, click on the BEAM course, and from there you can actually see everything in your training section. So I'll actually take you through that in just a second. So at this point, everyone should be able to see my screen. So as you can see, I am on lms.ctacny.com, and I've already created a profile. So I've entered my email address as well as my password, and once you click Submit, this is the screen that you should see. So this is your home page. Now, if you'd like to enroll in a course, you could simply view our catalog and see what we have offering right now. So all of our materials currently are pertaining to BEAM. So many of you have already done the provider application. And after today, you'll have access to the supplemental resources as well as the actual modules. Once you've enrolled in all of the courses, you click on My Training, and they'll all be here. So the first thing you would do is click on the green arrow to launch the lesson. The first one is a pre-survey, so we're asking a number of questions just about your experience with the tools that we're talking about in BEAM. And following that is the first module, which is Orientation to the Financial Benchmarking Tool. So just to give you an example of how that will look, once you click Launch this lesson, another screen will open up, and you'll hear us actually welcoming you to BEAM. From there, you'll have access to the module, which is a pre-recorded video, and after that, we'll ask you to complete a survey about that module. If you do have any questions or any concerns, you can always hit Help and submit a help request. So the help requests come directly to me, and I will answer them as soon as possible. Let me stop sharing my screen. And again, so if you do have any questions or concerns, you can submit them through the learning management system. You can also email me directly at jason.jones@nyu.edu. And just as a side note, I know that many of you are planning to view the modules as an entire organization in one group. Many of you have individual accounts. We are asking for this project that you use one account. And you'll get instructions about that to access the actual modules directly following this webinar. So thank you, and I will turn it back over to Dave.
Thank you very much. And what I'd like to do is spend a couple minutes actually giving you a quick view of the financial benchmarking tool, talk a little bit about why it was developed and what we hope that you'll be able to do with filling out the model. Well, the simplest thing is let me jump right over to the tool and show you. It might be easier if you're looking at this to be able to show the WebEx on full screen. You should see just below the top menu two little diagonal arrows running to the upper right and lower left. If you click on that, you should be able to go into full screen mode. It's going to just take me a second. I'm going to share my screen here.
And Dave, just a moment. WebEx needs to catch up with you. Jason needs to pass you the ball so that you're the presenter.
Okay, thank you. I'm sorry. Okay, now I'm the presenter, so now I can share my screen and get the right monitor and pop up the benchmarking tool. All right. So everybody should be looking at an Excel spreadsheet. I think that one of the things that you'll certainly notice that this tool is built inside of Excel. It doesn't matter what version of Excel that you're working with. It's a pretty simple, straightforward Excel spreadsheet. You'll notice that in the first tab on the spreadsheet, we have some basic instructions. They really speak to the tabs and what the goal of each of the tabs are. You're going to notice up here in the top here, let me make mine a little bit bigger, that you'll see a convention that we use throughout this model. Cells that are yellow are cells that can take input. Cells that are blue are cells that have formulas in them. So you're really going to be focusing in each of your inputs on the yellow areas of each of the tabs. Now, certainly the learning module will walk you through a more specific orientation to this model and step by step. I did want to give you the sense of what we were talking about here. This is a tab that allows you to put your fringe benefit as your percentage of gross, put your hours worked, and then start breaking out your direct care employed, direct care staff. Really take a look at your direct care staff or those individuals who provide billable clinical services to your clients. And you're allowed to break those out by different position titles, and you'll see that we use the CFR position code in there, so you might be able to bring this data down from any of your internal systems by position code to try to work out whether somebody's a supervisor or not. Because one of the important pieces that we do is we break out the difference between your indirect care costs and your direct care costs. Those indirect care costs are those costs that are not associated directly with providing clinical services to your staff. As you go through the training, you'll begin to understand the differences that the indirect care costs usually come into play when you have volume problems, but you'll see that as we go along. So you have a tab for your employees' direct care. You also have a tab for your direct care fee-for-service or contracted staff. Because your contracted staff are a little bit different, we normally will ask for the hourly rate, what percentage of an FTE that position would be, supervised, whether they're supervisor, the percentage that they're in direct care, and the CPT units per direct care hour. It's important that I take a second and talk about units of service, and the training will talk about that more as you go forward. As you know, unit of service definitions were one thing when, back before we transitioned to APGs. The unit of service counted in the CFR is one way of doing it. Some clinics count contacts, some people count weighted contacts. So to be able to use this model, given that productivity in units of service is such a critical aspect of fiscal modeling, that we had to rely on a definition of a unit of service that everybody would have to use for this model. And what we landed on was a CPT unit per direct care cost. You'll see that we did include in this model a tag called CPT, and these are the weights for the units of service. One of the reasons that we went to the APG CPT weight is because the CPT weights now recognize both your inputs and they correspond to your revenue based upon your inputs. So as an example, if you're doing a 45-minute psychotherapy visit, you may get a CPT weight of 0.82 because it's going to take you 45 minutes or more to be able to provide that service. If you provide that service as an individual 30-minute, you're going to get a CPT weight of 0.62 because it takes you less time. And your revenue is going to be reflected, the amount of revenue you're going to receive is going to be reflective of the time that you put into that. The other piece in this is that you see the CPT weights for your psychiatry staff nurse practitioners, psychiatrists is weighted at a higher level, taking into consideration that your costs for those, so those resources are higher. So we really now had a way of having our units of service be a measure of and be reflective of true revenues. So that's why we moved to the CPT way as our unit of service in this model. And that's an important piece. We break out your indirect care costs. Again, the blue is all the summary. We try to summarize data for you. So as you're going through and filling out the model, you can take a look at it at a summary level, make sure it still makes sense to you. These are your non-clinical positions and your other indirect care costs, including operating costs, equipment, rent, and administration and overhead. Again, we're working in a model here. A model is a representation of your clinics at any one point in time. And it's important that all aspects of this model get filled in. Then over to the model analysis, there's a couple of input areas here. One is billable to paid hours. The other is other revenue that is in your clinic that is not related to your payer mix. And you'll see as we walk through the training how to fill this out. One thing that I did want to make mention of, because I think it's a piece that people fail to recognize, we have something in here called no payment denials voids. I find many clinics tend not to fill this in. I have not seen a clinic yet that is able to return 100% of billed revenue that have no voids, no denials, or other problems that reject claims and make them, put them into a position that you cannot generate the revenue for those. So it's important you take a look at each of these different revenue sources very clearly. Again, we try to provide you as much summary data as we can. This is summary that should look very much like some of the summaries that you probably look at on a monthly basis. Certainly some of the summaries that are consistent with the way that the CFR data is. It's consistent with some of the ways that you might be budgeting. So on this tab, we put the summary together, and it's going to be really important as you fill out these models to continue going back to them and say, does this make sense? We're asking for a lot of data. It's a lot of detailed data, and in any kind of a situation like this, there's errors that occur. So again, always go back. Does this make sense? What did this look like last year? What does our budget say this is going to be? You know, what are we looking at here? So Medicaid revenue of $500. Well, that doesn't make sense because last year we had Medicaid revenue of $1 million. So you go back then to your areas that generate revenue, and that's productivity in your payer mix. Look at those closely. So at the end of the day, your summary should make a lot of sense to you. And then the value of the model is to go and begin changing some of these variables to try to move yourself to fiscal viability. And I know that we're going to say this in the training, but it can't be said enough times. This model is really designed in a lot of ways. What are the benchmark standards I need to be viable? What does my productivity need to be? What does my payer mix need to be? What should the ratio of my indirect to direct care costs? What should that be? What is the unit of service expectation I need from my contracted staff? How much are we going to pay them? And at the end of the day, where you're able to go through and change these variables in such a way that you can begin moving towards that fiscal viability that's going to be so important. And one of the things that I do want to say is I'm a firm and very strong proponent of taking a couple of small changes and seeing how they impact on your model, because I've seen enough organizations use this model, and instead of going in and saying, okay, I need to change productivity, we need to up it by 20%. Well, sometimes you need to change your payer mix by 2%, you need to decrease your denials by 4%, and maybe you need to update your productivity by 2%. And the combined effect of those three changes will be significant in many cases. The other thing we talk about with people is find low-hanging fruit, make small changes in the beginning that you know are going to be effective. There's a quick analysis tab here that you can fool around with prior to filling out the entire model. If you want to, the CPT tab is to allow you to see all the CPT codes, have a better understanding of that if you need to do and take a look at some of your service delivery. And then there's a data tab and a data CPT tab. You'll notice that all of these are formulas. You will not need to fill out these tabs because we'll use these tabs for data collection after you've submitted them. So I'm going to stop sharing my screen for a second and go back here, and that's the benchmarking model of brief orientation, beginning a much more detailed orientation in your first module that you'll be starting with the Learning Center. And now I'm going to pass this along to Rachel, who is going to be finishing up for us for today.
Hi, everyone. My name is Rachel Rivera, and I'm very happy to be working with my colleagues on this BEAM initiative. So I just wanted to start by saying what happens after BEAM. As Donna has already alluded, we are going to be doing CARE, the Change Action and Resource Exchange. We are anticipating on starting this on April 2016, well after the BEAM initiative. And just to highlight some of the areas we will be covering, just to say this will be a learning community approach to improve selected operational changes. We will be identifying content experts as needed, and we will be supplementing the trainings, and some of those examples include open access, centralized scheduling, and revenue maximization. Agencies with common challenges and needs will be grouped together to participate in special interest calls and routine check-in calls. Agencies will also be able to establish specific, measurable, achievable outcome measures to monitor towards change, and previous measures have included increase in productivity, reduce in no-show rates, improvements in outstanding accounts receivable. And also, we will be providing guidance in applying a performance improvement process to achieve high-priority organizational goals. Stay tuned for more information on that. So following this webinar, an email will be sent out that will have the following components. We will be sending out a link for the BEAM survey. Please be sure to complete this, as we will be using some of this information for this BEAM process. We will also be including links to our office hours. We want to point out that you do need to register for the office hours, but we really, really encourage all of you to participate, as there may be questions that your agency may not have even thought of as going through these homework assignments and going through this initiative. So please be sure to log in for our office hours and to register. And you will also be given a link for the financial benchmarking tool that David had just reviewed. We would highly recommend that you do download that as soon as possible and get started with your CIP. So other next steps and reminders include to go to the CTAC Learning Center and to enroll if you have not already done so. We also want to remind everyone that it would be great to have all of your coverage on one account. That way we can track where you are. And if you have any questions from today's webinar, or if you just have any questions in general, please be sure to send them to beam@ccsi.org. We want to make sure that we answer all of your questions, and we also like to receive these questions in advance so that way the office hours are a little bit more targeted. For everyone's information, the first office hour will be held on Monday, October 19th at noon. And also, today's video will be available in the CTAC Learning Center by tomorrow, the 14th, for any team members who are unable to attend today's events. And just as for next steps, be sure to establish a regular schedule and begin meeting as a core implementation team to get started on these webinars. So again, if anyone has any questions at all, whether in reference to today's BEAM webinar or for any future ones, please be sure to contact us and send any questions to beam@ccsi.org. And on behalf of everybody on the BEAM team, we really want to welcome you, and we really look forward to working with all of you.
Thanks, everybody. Goodbye.
Thank you.